Hello, and welcome to the Postpartum Years podcast. I'm your host, Dr. Ellen Kramp, but I am not the host today. My host today is my daughter, Elena, and she is interviewing me about the postpartum period that I had following her birth. So take it, Elena.
Yes, hi, I'm Elena. I'm, of course, her youngest daughter. And if you've heard our previous episode, we cover, my rather eventful birth story. And I myself am an occupational therapist, and you may hear some of that come through because got a lot of questions regarding her recovery and her ability to do some of the basics of taking care of herself and taking care of me and what that looks. So since I am the host, I'll go ahead and jump in with some of the questions. What was the physical recovery like after you had left the hospital? Kind of like coming home for the first time with me.
Coming home with you, I was so tired. I was, I still felt like I had been run over by a truck. I was the most miserable after that birth compared to the other two births I had had. Um, I couldn't understand quite, although I did remember the OB coming in and checking on me at one point, and he's like, "Oh, your hemoglobin is really low. It's at the point where we normally transfuse, but you look good, so we're not going to transfuse." Um, so I wasn't given any blood then either, just plenty of IV fluids and water and, food and stuff. So it took me a really, really, really long time to recover after that C-section. So I'm really glad that it happened then, because your sister was born when your dad was in med school. Uh, so I was the primary income then, so that would not have worked well. And then your brother was born during his internship. So again, he's making peanuts. So that wouldn't have worked well then either. So I was able to take an extended period of time off after you were born, but I was extremely fatigued. Um, just when the hemoglobin's really low, that's what carries oxygen in your
Yeah.
blood. So, trying to heal from the pregnancy, heal from the C-section, heal from the infection, heal from all of what was done during that birth, plus try to rebuild blood cells and yada 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 yada. Um, it was it was hard. It was really hard. Um, so I'd get fatigued very quickly. Plus, I'm trying to breastfeed at the same time. So, on top of it, my body's trying to produce milk for you. And so there's like another stress on my system at that point in time. So, I had that. In addition to that, to go into the TMI, it was like hemorrhoids and a fissure that I had that made going to the bathroom extremely uncomfortable, to the point where an anal fissure will cause the pelvic floor to completely spasm
Oh.
after a bowel movement for hours, incessantly. And it's extremely painful. So if you can imagine a Charlie horse in your pelvic floor that lasts for hours, that's what it feels like to have an anal fissure. So I had that on top of everything else. With the lack of oxygen and the low blood pressure during the surgery, um, I actually had memory issues. And where I had had a memory where I didn't need lists, I could do calculus like in my head. Um, I was having trouble balancing a checkbook. I was having trouble, like if I saw something in the room, like, ooh, I want to take that thing with me when I leave the room because I was coming in for something else, I wouldn't remember. I couldn't remember the typical things that I could easily remember previously. I was able to get quite a bit of that back. The math skills never fully came back. Yeah, I can add and subtract better. Honestly haven't tried calculus in a long time. Don't need to in my job, but having rather elite math skills and then having trouble adding and subtracting afterwards was rough.
Yeah.
And then having a memory that I could remember like 1,000 different things at the same time, and then I could remember like 10. That was rough as well.
How long did that kind of cognitive recovery take? Was that something that, got better within weeks? Was that months, or was that kind of like a slow rebuild
That was a
with
slow
like
rebuild.
adaptive
Months,
strategies over the years?
months to years, really. Um, and I don't, my memory's still not what it used to be. And that's really frustrating for me. I mean, I always had word finding problems. It's a little worse afterwards.
Yeah.
um, and the math skills, like I can't do it in my head. I have to have a pencil and a piece of paper to be able. I can do it, and I just kind of almost feel dyslexic with it now. Um, so it's interesting. It kind of made me appreciate people who struggled with math a little bit. So like, why do people complain about algebra? Algebra's easy. It's like, why don't they even teach it? It's just like, it's common sense. Like, I don't understand you people. Oh, I get it now.
Of course, there were like the cognitive impacts, but I also wonder, like, how long did it, like, were you able to bend over and like pick me up out of a crib after that week of coming home following that surgery? Was that
Yeah. Yeah, I could do that.
okay?
I could do that. I did like my abdominal muscles wouldn't contract. So I had to use everything else because when it felt like things just fell apart, my lower abdominals would not function.
Yeah.
And being a PT and knowing how to make them function, I could not find a way to make my abdominals fire. It was crazy. And I saw, a couple different doctors over the years, and they all blew me off. It wasn't actually until this past summer where I finally saw it was two different surgeons. I found one actually down in Florida in Sarasota who did hernia repair. And I did a consult with him, and he's like, so let me tell you what happened. And he goes, so what happened was after you stood up after your C section, the muscles came apart. That's what you felt. Your lower abdominal muscles that they cut through and sew back together afterwards came apart. Um, and what you have now, like the only reason they're able to come together at all is just it's scar tissue that's holding your
Oh,
abdominal muscles together right now. So he referred me to a doc that he knew in Annapolis. And I had the surgery there, and I had basically a hernia that was 9 centimeters wide and 15 centimeters long. Um,
oh,
so he sewed up the muscles and put in a large mesh because yeah, there's no way. And as I've listed different things over the past several months, um, I know had he just sewn the muscles together and not used the mesh, I would have blown that apart too.
yeah,
So I'm very glad the mesh is there. Very, very glad the mesh is there. So mesh can be a very, very good thing. Um,
yeah.
but yeah, I could easily pick you up. I could easily feed you. Um, you, it was interesting with you personally because and I had felt this in myself too, because I had gone through 20 hours of labor and then all of a sudden was knocked out and had a C-section, I personally felt like I hadn't completed the birth.
Mm,
Um, and it was really weird. I felt like in dreams, my body was like trying to finish. It like my body, like on a cellular level, felt like this is wrong. Like you didn't finish, you
yeah.
didn't have this baby. Um, and then you, at the same time, I'd be holding you, and you'd kind of be like in this dive, like you didn't finish right either. So I had to actually do some treatment with you to let you process that because I could feel that in your body where you were really agitated and you were like just trying to like you would be throwing yourself down. It was and you were just like a week or two old, and I could just feel like there was this part of you that was needed to work some of that out. So I just kind of worked with you on that. And I see that in a couple of, you know, every once in a while I get a baby like that too, where I'm like, okay, I'm just going to let you work this out because, there was some process here that happened that you
There's
you
some
need to
instinct.
do. Yeah. So that was that was interesting. You were struggling with that. I was struggling with that, and I had to help you kind of through that process. So, working with the cranial stuff I know and all that, you know, you calmed down like really, really well after um, that because you were just, it was so hard for you to settle. And part of it, I think, would also be, um, you were lacking oxygen
Yeah.
often and often enough that, your heart rate's dropping um, during the labor. So for you to, be in that situation, then not go through the birth, suddenly be ripped out very abruptly, that um, nobody in the room is calm.
Yeah. Yeah, it doesn't sound like it was a very calm OR.
No, no. And then,
Oh,
as a newborn, it's not like you can come out and go, "Oh my God, can I tell you what happened?"
I know
Like,
I didn't have the words.
yeah, there were no words. Your system is like your nervous system is just being bombarded with, "I'm going to die. I'm going to die." Oh, okay, okay, I'm okay. I'm going to die. I'm going to die. Okay, everything's okay. Everything's okay.
Yeah.
I'm going to die. I'm going to die. So, when you're repeatedly going through this, I can't imagine that, that's okay on your nervous system. And then to have no words to express, you know, what had happened, no frame of reference. So that, you know, I can't imagine how that impacts somebody.
In the long run.
Yeah.
I know you mentioned kind of like the fussiness and like the head throwing back. Was there any other difference that you had noticed with me that you kind of associated with, potentially like either the trauma of the birth itself or it having been like the C-section?
No. Um, I mean, you were really hungry. You were really hungry, but I don't know if that was just you or your size. I think you were hypoglycemic initially, probably between the trauma um, of the birth and just the, more the trauma of the, heart rate deceleration.
Yeah.
um, but you were just really, really, really hungry. Um, and kind of ripping my nipples apart there for a little bit because you wanted milk. You were just like, yeah, this colostrum's great, but give me some food. So I had to supplement with formula for you for the first um, 2 or 3 days until my milk supply was enough for you, just to keep you well nourished.
Yeah, you mentioned, correct me if I'm wrong, but I gained a pound in the first week.
Yeah, babies, especially the larger ones, tend to lose a significant amount of weight in the first week. And we'd gotten out of the hospital. And then, like, the next day or two, I'm having to take you back to the pediatrician because it's your 1 week checkup. And you were born at 9 pounds, 1 ounce, which I still question because you seemed bigger than that. Um, and um, when you went in for your 1 week checkup, you were 10 pounds. And the pediatrician just kind of hands you back and go, yeah, she's fine. We can skip the 2 week checkup. I can't imagine if we had just let you stay in utero and grow to whatever size you wanted to be and be ready to be delivered, what size you would have been.
Wait, was that remind me, was that the reason for the planned induction?
Was your size? Yeah.
Was my size?
Well, because you were like 7.5 pounds at 36 weeks, which
Yeah.
is, the average size of the 40-week baby.
Yeah. So, chunky baby.
Yeah. Well, I mean, I was a 10.5 pound baby,
Yeah.
born one day overdue. So, and of my 8 siblings, 7 of us were over 9 pounds and 2 of us were over 10. And the
Wow.
two, the two that were under 9 pounds they were both born 3 weeks early.
Okay.
So
So, had they
had
been in
they,
utero just a little longer,
yeah,
they
they
would have
probably,
caught
yeah.
up.
So
Just big baby genetics.
yeah, yeah. So large babies didn't surprise me. The one that surprised me was Allison, but she was born at 37 weeks. She was 6'12".
6'12". Oh wow, that is much smaller than I was. I knew she was born more little and that she was born 3 weeks earlier, but I didn't realize she was only 6 pounds 12 ounces.
Yeah, she was my itty bitty little peanut, the only one that like was actual baby size.
Yeah,
Because I
not the three.
remember, I remember when I think it was when the nurse handed you to me that next morning. She's like, "Here's your 3-month-old."
I think another thing I've wondered is just like along with the physical recovery of coming home. I mean, I imagine taking care of yourself and of me is well entirely exhausting. It sounds like you were um I don't know, anemic, is that the
Yeah, I was
yeah,
very anemic.
very anemic. um, Leading to some of that like low energy, making any kind of like basic care much harder.
Hmm.
Um, but there were two other kids around.
Yes, yes.
So at that point, David was 3.
4.
Oh, he was 4.
He
He
was
was 4 at
4,
the time.
and Allison was 7.
Alice 7. Okay. Did you guys have any other help around? At that point, you had just moved back, but I wasn't sure if like Grambo, your mother, had come.
No, no, she was still working at that time, so she couldn't just take weeks off. And she was a widow, so she was her only income. So she had to keep working. My brother lived in Lutz, but that's 45 minutes away.
Yeah, and he had
Um, and
two
he was
little
working,
three little
and
ones as
yeah,
well.
and Kelly, his wife, was working, so they couldn't help. And then we had just moved into this neighborhood and really didn't know the neighbors well enough. Um, so that was, yeah, we didn't really have any help.
Yeah, in my brain, Grambo has always been retired and there for baby. So to hear that she was working and not there and present for a baby is
Yeah,
my
she
brain.
was she was only 63 when you were born. So
Okay, yeah, a
yeah, she
little
was,
different from how I remember her
yeah.
just a couple of years later. I forgot, like, oh yeah, she worked at a certain point. Um, so I mean, having navigated all of that kind of within the 2 months you guys had with each other and the three of us, how was that like mentally too?
I mean, Allison and Dave were good kids, so it wasn't that big of a problem, and they were googly over you. So
I have seen some of those photos.
yeah, they thought you were really cool to have around. So yeah, and they were in school, so that David went to preschool. Allison was in second grade, so in school starts in August in Florida. So
Perfect
that
timing.
yeah, so during the day it was the two of us and your dad, and um, so yeah, I was just trying to heal, um, and I was going to acupuncture to try to feel human again for a
Yeah.
while afterwards. Ended up having the hemorrhoid and fissure surgery because um, it was so hard. It was, I mean, that pain was. I went through that for almost 7, 8 weeks straight,
Okay. And
and
that was all the fissure followed my birth.
I actually had it after all three.
Oh,
But I was
after all.
able, yeah, I was able to heal it after the first two, but after
Okay, no.
yours, it just wasn't letting up at all, and I was almost losing consciousness on the toilet. So it was time. It was time. Your father was standing there one time, and he saw me like right afterwards, and he's like, "Are you ready to get the surgery yet?"
Tough it out.
Like it'll heal. He's like I think you're ready. What an ER doc is telling you, it's time for surgery. Because you
When
know,
dad's saying something, it's like, okay, it's
yeah, okay, yeah, it's time. Like you can tell. Okay,
time.
yeah,
Yeah.
because people think it's, oh, you're married to a doctor. Oh, they take such good care of you. ER doctors like
Unless you're
you're,
dying.
yeah. Unless you're at the point where you really need surgery and they can tell, they're just kind of like, you're fine.
Yeah.
So yeah, I ended up getting the surgery, and that was November that year. Um, so yeah, it was over a little over 2 months I put up with that. Um, but yeah, after that, I felt like I could really start healing a lot more because I wasn't just like so in pain all the time. The abs, I just couldn't use them. And that took probably about 10 years before I could finally get them to turn on again.
Oh,
Yeah.
how did that change the way that you were able to move or like the things you were able to do?
Like in order to get up out of bed, like just to lift my head and shoulders, I'd have to push my elbows into the bed to, lift my head and shoulders. Um, I really had to use my legs. And, being a PT, we learn how to help people do different things. Um, yeah, I knew all how to compensate really well, but that was rough. I tried everything under the sun. I tried all sorts of different exercises. I tried E-stim. I tried corsets. I couldn't, nothing was working um, until we did. I was in a course and we did some mobilizations, and all of a sudden they kicked on. They were still way the heck out here, but they kicked on, and I was able to start using them a bit more. And Pilates helped me use them quite a bit more still. But I would have to like set things up, like do this like pre-contraction kind of thing in order to be able to do like I'm just going to get up. Like I couldn't
Yeah,
just get up. I'd have to like do the setting first.
manually.
Yeah, and then I could move. And the funny thing is, had discussions with plastic surgeons over the years, and even some general surgeons, and they call a diastasis, which because that's what it's called when the rectus abdominis muscles are separated. They call it cosmetic. And I'm like, yeah, I'm a VT and I will die on that hill. It is functional. It is not cosmetic. I mean, if they had to like go through these gymnastics moves in order to be able to lift their head and to sit up, um, yeah, that's not cosmetic.
No.
It it created a lot of back pain that I had to deal with over the years, and since then, um, no back pain. My pelvis had been really unstable, and since this last surgery, it's been really stable and it's been fabulous. It's
Oh,
great not having this constant back pain or intermittent back pain. It's great not having like a pelvis that constantly needs to be readjusted. The amount of money I'd spent on chiropractors to keep readjusting stuff because I didn't have the muscular stability. And there was no way for me to have that muscular stability because they're like way out here. They're not connected.
was your diastasis, that was the result of
The C-section.
the
But
C-section?
and standing up the next morning and it came
The
apart.
Yeah. Okay. Um, I know that's something that is relatively common, right, amongst mothers. I know you're covering this in
Mhm.
some other episodes, but I was curious, is that something more seen in C-sections, or does it occur with natural births as often?
It's actually much more common in the upper abdominal muscles. Um, the way it happened with the C-section was more like an incisional hernia is what it's called. So it's more due to that incision that they had done.
Gotcha, and that's why
That
it was lower abdominal.
that why it was exclusively lower abdominal. In most women, it's in the upper abdominal area. Sometimes, often through the belly button, and sometimes the entire length from the um, basically the ribs down to the pubic bone.
Whew.
Yeah.
Yeah. It doesn't sound cosmetic. That
No, no,
sounds like it
it's
would be
not.
beneficial for, using your core
Yeah, yeah.
support. So along with, of course, like the physical recovery and that the effects that that had, I also always kind of wondered, especially as I was going through grad school, because we did this a project that was along the lines of a qualitative study looking at the lived experience of women postpartum in terms of their mental health or their experiences with like postpartum depression or anxiety. And I wondered, especially with me having almost lost my life and you having almost lost your life in birth, did that come up for you?
Um, no, the only thing I felt like I was dealing with um, on that level was like just that weird. I didn't feel like I completed the birth. I was more angry that they um, failed to tell me what was going on, that they failed to treat me, that they tried to kill me 3 times.
Sounds like your anger
Like,
was valid.
like the nurse who did not ask, "Do you want pain meds?" Because I would have said no, because I, I,
Yeah.
I typically, I don't like what they do to me. I don't take pain meds typically. If I take anything, it's like naproxen or, um, ibuprofen. So, I mean, that's how I manage my pain. So, I don't want to deal with narcotics. I don't want to deal with that kind of stuff. Um, so, yeah, I never would have asked for that. Um, I think it would have been nice for the OB to tell me and have a discussion with me about, hey, just so you know, this is what happened during the procedure. Um, this is maybe why you are feeling cruddy. Expect this, expect that. How are you feeling?
Important
um,
question. Important question for physicians to ask.
Yeah. Um, like, okay, your hemoglobin's really low. How are you feeling? Do you feel like you need blood? Do you feel like um, something like that? Especially being a health professional. Um, you know,
Yeah.
I, I understand things on a different level than your average person, but the discussion would have been nice. So I could have said, yeah, please give me blood. But I was so exhausted at that point in time. Like I didn't want to get out of bed. I did not get out of the hospital bed other than to go to the bathroom until the day I was discharged. And like after your sister was born, I was ready to walk back to the postpartum room. Um, and the next morning, I'm like, can I go home today? Because I don't want to be here. And he did. He let me go home that day. So your sister was born at 1:45 in the morning, and I would have been home within 12 hours had your father been around. But
Wow.
because her birth took us kind of by surprise, he was picking up stuff for the house for her. So, yeah, I mean, I was home that afternoon,
Wow.
and yeah, I don't sit still. It's like, after surgery, I'm up and down all the time, and I couldn't even fathom getting out of that room. And I was so depleted that I couldn't even advocate for myself effectively to say, hey, give me blood. But having him bring it up would have been helpful
Yeah.
instead of him just making a one-sided decision of like, nah, you're good.
Yeah. So dealing more with like residual anger from
Yeah.
the treatment.
Yeah. I don't feel like I had any anxiety. I didn't have any depression. The only thing that I found interesting was all of a sudden I'd be crying, but there was no emotion attached to it.
Hmm.
Like I felt like my face was leaking. I'm like, this is weird. I'm not sad, but tears are just pouring down my face.
Yeah.
To me, that was odd because it's not like, oh, I feel so depressed. Like, no, I was initially it was like just the pain and um, such, but I didn't feel depressed. Um, I didn't feel anxious. I was more grateful that you're okay. I lived. You seem to be fine. And the little bits that are going on, are things that I can personally help you through. So, yeah, I don't feel from a mental health perspective I was struggling at all. It was more from a physical perspective, I was really struggling.
Yeah. Yeah. It sounds like you would have been exhausted and in a lot of pain
Yeah.
and sometimes body wants to let it out.
Mm.
Plus all of the hormones that come
Oh, yeah.
with the post birth postpartum period.
Yeah,
Um
totally.
yeah. Um so I guess to in part round this out, what were the best parts of the postpartum experience? What were the highlights? We've tackled really heavy topics. I mean,
Yeah. Well,
was that
that uh, that was hands down the worst of the three births and postpartum periods that I had. I mean, the other two I had hemorrhoids and fissures with them as well. And so, but that was the only thing I really had to deal with, um, other than just kind of healing from the birth. Um, but the happy parts, I mean, it was just like, oh my God, you were so cute.
I was an adorable baby.
Yes, you were like the Gerber baby. You were just so beautiful. And you were fairly easy too. Um, you you slept fairly well. I mean, you still like to get up a couple times a night for the first year, but you slept fairly well. You would, um, you were really happy. Um, it was just nice to be able to, and feeding was, after we got through that first little bit, feeding was really easy. Um, yeah, it was, I mean, other than that, it was like the typical happy, you know, new baby, joy in the family kind of thing. Yeah, so
Sweet.
other than dealing with my own physical issues.
Yeah.
um,
Oh,
yeah.
yeah. And just really, I just have one more question. So, for me, it's always been so clear, like how much you love being a mom and how much dad loves being a dad. And I'm curious how much of that shaped. I mean, you kind of going into this field and kind of like this mission of creating the postpartum years projects.
Oh gosh. Yeah, I feel like so many women go through this process and they don't understand that they can get help. Um, so they don't understand what the issues are from a medical standpoint. They don't understand um, because of dogma over the years, like, oh, you had a baby, so of course you're going to leak. Oh, of course your abs are going to be weak because you had a baby, or that's just the baby pooch, or that's just, um, rather than, oh, you should really go see a PT because that's a diastasis, and they can often help with that. Or you should, or the PT goes, you should really see a surgeon because that's far beyond my scope. That's going to require a scalpel. That's going to require, something that I just, it's not in my scope of practice. Um, yeah, I mean, I definitely enjoyed being a mom. I always wanted to be a mom. I I have an infertility side of my practice that, I feel like everybody should have that easy fertility that I had. And I want them all to like enjoy, like, okay, let's start trying. Cool, pregnant. I want them to be able to get pregnant easily without spending tens of thousands of dollars. Um, I want them to be able to enjoy their own bodies after they give birth so they can enjoy their babies more without feeling so exhausted, without feeling so, so much pain. To be able to feel like their muscles are contracting normally, to be able to pee normally when they want to and only when they want to. Um, I want them to be able to have sex again without any pain. Luckily that was never a problem for me. Um, but everything else seemed to be. I want them to be able to poop without a problem. I want them,
Yeah.
only when they want to. So, yeah, I mean, it's with doing what I do, I think everybody should be able to do that, to have a baby, get the treatment that they need. In a lot of countries in Europe, they automatically get physical therapy afterwards. And here, I still to this day have patients say, my OB told me that I didn't need PT. Well, let us make that decision. Send them to us and let us make that decision because I can guarantee they probably need PT. Even if it's just for 1 to 2 sessions where we can say, hey, just so you know, in the future, try this, or maybe don't start that weight program yet. get back to the heavy weightlifting. Give yourself a little bit more time before you get back into heavy weightlifting, or running, a marathon. Like, give yourself a little bit more time. Just assess where they are and see, where it goes. So that's, I guess where I feel like I am as far as, um, wanting to write this book and with my practice and treating people on a regular basis for a lot of the same issues that I had had postpartum.
Very clearly needed, I don't know, a source of information where it's just there's so much that we don't talk about now, and so many people deal with, I mean, physical and mental health issues postpartum. And yeah, I think you're doing really, really amazing work in making sure that people know they aren't alone and that there is help. Oh my gosh, there is so much help out there, so many
Yes.
resources, and that these kind of chronic issues that come with the postpartum experience aren't just normalized.
Hmm. Yeah. Yeah. They may be common, but they're not normal, and they can be helped often. Thank you very much for joining us in the postpartum years, and I hope you learned a little bit from my own story. I'll see you next time. Bye.